Welcome, everyone. Thank you for joining me this afternoon. My name is Shannon Meyer, and I'm a Kaplan nurse consultant. Many of you have heard about the National Council of State Boards of Nursing's research and project related to clinical judgment and much anticipated changes that are coming to the NCLEX RN examination format. Today, I'll be discussing clinical judgment and how it correlates with the next gen NCLEX. Throughout this presentation, I will refer to National Council of State Boards of Nursing, or NCSBN, or National Council as being of the same entity. Furthermore, the words client and patient may be used interchangeably, but refers to the individual at the center of care delivery. Clinical judgment is not new to nursing. There have been discussions, studies, and evidence to support the development and the use of good clinical judgment in nursing for more than a decade. So why is it still not at the desired level expected for nurses as they enter the workforce? According to the NCSBN's Next Generation NCLEX project, it's been determined that nearly half of what nurses do in the clinical setting is make clinical judgments. To better prepare our nursing students to make those clinical judgments in the clinical setting, we as educators need to realign the way we facilitate learning with our students. In preparing these students for entry-level practice, we need to incorporate more opportunities for students to engage in this clinical judgment. But before we can do that, educators need to fully understand clinical judgment, its relationship to nursing practice, and the next gen NCLEX. It's also necessary to understand that there are building blocks of clinical judgment which include critical thinking as well as clinical reasoning. With that said, let's go ahead and take a look at today's objectives. We're going to define critical thinking, clinical reasoning, and clinical judgment as it applies to nursing practice and the next gen NCLEX. I'm going to differentiate between critical thinking, clinical reasoning, and clinical judgment, as well as share some common themes among the three. I'm going to explore examples of what each of these looks like in both classroom and clinical environment. And we're going to identify strategies to develop critical thinking, clinical reasoning, and clinical judgment in pre-licensure nursing students and for the next gen NCLEX. Lastly, I'll identify methods to assess and evaluate critical thinking, clinical reasoning, and clinical judgment. Over the years, we have heard of the words critical thinking. There are many definitions for critical thinking in the literature. I've shared two brief definitions here, which sum up the meaning of critical thinking very nicely as it relates to nursing. Victor Chmiel defines critical thinking as a cognitive process used for analyzing knowledge. Ben Singer added in 2015 that critical thinking is the ability to analyze information, draw conclusions, and implement a plan of action. You can see some similarities in these brief definitions. Nilsson's shared a nice summation of numerous definitions for critical thinking by stating that while they're all very slightly different in their terms of definition, we can all agree that critical thinking involves the cognitive operations of interpretation and or analysis, which is often followed by an evaluation. As we explore further, let's take a look at some models that identify the necessary process that correlates with critical thinking, clinical reasoning, and clinical judgment. The first process of critical thinking is what I have here to show you. The Nursing Executive Center has identified critical thinking to be composed of 5 core components. In this particular model, the first component begins at the 12 o'clock position, moving in a circular pattern, going clockwise. You can see that it starts with problem recognition, moving into clinical decision making, then going into the next phase, which is prioritizing care to develop and implement patient-specific interventions. The last step is a reflective step, which can be that of the student's reflection on how the process evolved the outcomes for both the clinical situation as well as the client situation, or it can also be an evaluation of the clinical situation in and of itself. This process, like many other in nursing, is ongoing and often leads into recognition of other problems or decisions that need to be made and acted upon. Similarly to critical thinking, over the years, many definitions have been developed for clinical reasoning. Many have stated that clinical reasoning is taking critical thinking to that next level. Again, Victor Schmel shares the definition of clinical reasoning as being the cognitive and metacognitive process used for analyzing knowledge relative to the clinical situation and or specific patient or client. Furthermore, Lapkin has shared a more detailed definition of clinical reasoning as being the process by which nurses collect cues, process information, come up to an understanding of the patient or client problem or situation through processing of that information, develop a plan and implement interventions, evaluate outcomes, and reflect on learning and learn from the process. Again, you can see common words throughout these definitions for clinical reasoning. Lapkin's definition sounds very similar to what we all know as the nursing process. One piece I think is missing from these definitions is that clinical reasoning, like critical thinking, is an ongoing process, a continuous state of evolution depending on the outcomes and the reassessment of the patient or client situation. Let's take a look at Hoffmans Model, which represents clinical reasoning. Again, this model is circular and begins at the top, but essentially has no end as it's a process like that of critical thinking. It's ongoing. Elements of this clinical reasoning cycle include consideration for the patient's situation, collecting relevant clues and information. Next, it moves into the process which requires the student to process the information using what they may have already learned or known and applying this new information to the current clinical situation to allow them to move into the next phase of identifying problems or issues. From here, the student will begin to establish goals that are appropriate for their client. These can be independent or in collaboration with the patient or client or with other healthcare professionals. Once goals are established, the direction path is then taken to the actions phase, or again, in some circumstances, understanding that an action may be not taking an action at all. After the implementation or action phase, the student must then determine if the outcome aligns with the desired goals in the evaluation phase. It may be that more cue or information gathering is needed, and or the student needs to process further to identify different or more problems to go back and tweak the goals and the actions that need to be taken. This again sounds much like what we know as the nursing process. However, in the clinical reasoning model, there is an added component of reflection. In this phase, the nurse or the student revisits this process, determines the new information that was learned, and makes a determination if further information is needed to meet or achieve the desired outcomes. The student can also reflect on the clinical encounter and use this information that has been learned to move forward in and apply what has been learned or experienced when approaching a new clinical encounter. Let's take a look at clinical judgment. I really like the National Council of State Board of Nursing's definition of clinical judgment, and that being the skill of recognizing clues about a clinical situation, generating and weighing hypotheses, taking action, and evaluating outcomes for the purpose of arriving at a satisfactory clinical outcome. Clinical judgment is the observed outcome of two unobserved underlying mental or cognitive processes, critical thinking and decision making, otherwise known as clinical reasoning. In 2006, Tanner defined clinical judgment as an interpretation or conclusion about a patient's needs, concerns, or health problems, and/or the decision to take action or to not take action, use or modify standard approaches, or improvise new ones as deemed appropriate by the patient's response. Again, you see some similarities which resonate with the nursing process as we look at this definition. The next two models I'm going to share with you reflect that of clinical judgment. Here you'll see Tanner's model for clinical judgment, which was one of the earlier models for clinical judgment in nursing, developed by Tanner in 2006. Like others, this too is a process which takes the nurse or the student through phases. You'll also notice that it is an ongoing process. The four pillars of Tanner's model include noticing, interpreting, responding, and reflecting. The noticing phase is the cue and information collecting or recognition phase. This can include information from the patient or client handoff in a report from another nurse. It can also include information retrieved from the electronic health record or patient record, or during the first encounter that a student may have with the patient. In this phase, can the student pick up on actions or behaviors and determine what information is relevant to the clinical situation? This phase is often influenced by context and experience. A novice student may not have the experience or may not have the knowledge that's required and may require more guidance from their faculty in those earlier phases. The student takes the current knowledge and this newly discovered knowledge and begins to move into the interpreting phase. Here, the nurse or the student will identify patterns through the analysis of the information gathered. They'll apply intuition and use history from previous patient or client experiences to begin to develop appropriate actions based on what is known and what the desired outcomes are, and prioritizing the nursing care from that point forward. Moving into the responding phase, the student then carries out these intended actions. In this phase of Tanner's model for clinical judgment, you'll notice it has two ways of responding. And those are responding in action or responding on action in the clinical learning environment. You may also take notice that the reflection in action can go both ways, back to the outcomes phase or forward to the reflections phase. Tanner's model for clinical judgment combines the cognitive, psychomotor, and affective aspects of thinking like a nurse, which is demonstrated throughout the four phases of noticing, interpreting, responding, and reflecting. Moving on from Tanner's model for clinical judgment, we'll take a look now at National Council's clinical judgment task model. This model you see before you has been slightly modified as our focus is going to be on the process as well as the phases that are fluid throughout the model. You'll see that there are layers that this model is divided up into, and within those layers, you have the phases. These key phases are recognizing clues, analyzing those clues, prioritizing hypotheses, generating solutions, taking actions, and evaluating outcomes. To share some examples with you from each of these phases, exploring signs or symptoms or information gleaned from a client history would lead to cue recognition, allowing the student to identify important components within that information. Determining the client's needs, concerns, or problems would equate to the process of cue analysis. The student then begins to formulate hypotheses, determining an order of importance or priority, engaging in communications, anticipating consequences or risks, and understanding the level of complexity and time needed would begin to help the student prioritize those hypotheses and generate those solutions or develop actions to implement in the client-patient encounter. From there, then the student can then refine hypotheses as needed as more information is obtained. The student then can determine if the necessary actions that have been developed to take will achieve the desired outcomes. And then following this process, the student will then evaluate those outcomes, which may mean that they continue forward with the process, or they might have to go back and gather more information, recognize further clues to redefine or reevaluate their hypotheses, and then generate new actions based on what the client needs are. Some of the common themes are shared among the models include problem and cue recognition, processing of the information, taking action or implementing care, and reflecting on the process, which also can include the evaluation of the outcomes. Dickinson, Herling, and Lassiter wrote an article that demonstrates the integration of the National Council's clinical judgment model and nursing education frameworks. The authors use a hypothetical pediatric patient scenario, which can assist in assessing the student's ability to make those clinical judgments. Let's consider this example. A pediatric client enters the emergency department with their parents present. Here, the student can recognize environmental cues. Observation cues might include that the child is somewhere between the ages of 8 and 10. The assessment might show that the client has dry mucous membranes, maybe is showing signs of lethargy. Their extremities might be cool to touch, and their capillary refill might be slow, 3 to 4 seconds. The student can also take a look at the EHR and determine some trending with vital signs. They might notice that there had been a low-grade temp. There might be a family history of diabetes. They may see that there's been reports of diarrhea, loss of appetite, and then they can take this information and examine the time sensitivity in relation to the onset of these symptoms, as well as the acuity or the severity of the symptoms. Then analyzing cues, the students would need to pull forward information that they know about dehydration and perhaps about diabetes. They need to prioritize care, which might include getting vital signs again and comparing to what they were before to what they are now. They may have to get some labs, particularly a blood sugar on this particular patient. They're going to start generating solutions. Again, generating solutions requires them to pull in on previous knowledge from pediatric development that they know, signs and symptoms, treatments and interventions related to dehydration, as well as those related to diabetes. Knowing the findings and what data is necessary to report out and act upon, they can anticipate actions and begin to develop interventions, such as maybe initiating an IV to counteract the dehydration that is assumed. From there, the students will then go ahead and evaluate the outcomes after the interventions have been applied. And through this assessment and the evaluation of these outcomes, they may take notice that the child is now sitting upright. Maybe they're talking with their parents, smiling. They're noticing less signs of lethargy. And they want to go in and follow up and recheck the vital signs to see if there's been any change in their status from that standpoint. So based on the brief definitions that I've shared with you, along with those models of examples of critical thinking, clinical reasoning, and clinical judgment, we can conclude that they are interconnected. However, they are all quite different from one another, but nonetheless, they're designed to work harmoniously with one another to derive at the desired outcome of improving patient safety and engaging in safe clinical practice at the point of entry into profession and beyond. To put it in perspective, critical thinking with the addition of clinical reasoning can equate to clinical judgment. Thinking of this process as analyzing information, applying what is already known to develop a plan, and acting or perhaps not acting on that clinical situation using sound judgment that's going to lead to safer, more effective, and efficient patient care delivery. Again, as defined by the NCSBN, clinical judgment is indeed the observed outcome of critical thinking and decision making. Furthermore, it's recognized as an iterative process that uses nursing knowledge to observe and to assess the clinical situations. It requires the identification of a priority concern for the patient, and it generates the best possible solution or a sound solution based on evidence to ensure that that patient care is safe in its delivery methods. As nurse educators, we need to guide our students through the development of good critical thinking, clinical reasoning, and clinical judgment skills. Think of it as climbing a mountain, starting at the base and developing those foundational critical thinking skills. From there, you ascend that mountain alongside with the students, gathering those necessary elements to enhance their understanding and practice of these essential cognitive nursing skills. Adding in metacognition as the student develops that clinical reasoning skill before reaching the top, allowing them to make those good, sound clinical judgments during each and every patient patient or client encounter. In addition to making these clinical judgments, they then deliberately take in the opportunity to reflect on the encounter, share feelings about the outcomes for the learner, as well as reflecting on the patient or clinical situation. We know that as educators, in order to get good at developing these skills for our students or in our students, educators need to provide plenty of opportunities for the students to practice and reflect along the way. Let's go ahead and take a look at what some of these examples look like side by side. Here's a simplified table which shows examples of what critical thinking, clinical reasoning, and clinical judgment look like. These examples are interwoven throughout the clinical encounter or experience. Hopefully, by sharing these examples with you, educators can see action words and come up with creative ways of engaging the student in developing the necessary cognitive, psychomotor, and affective components of learning. Let's take a look at what critical thinking looks like in the classroom. Here are some examples of how educators can enhance the student's ability to critically think in that classroom environment, keeping in mind what the objective is here with each activity. For critical thinking, we know that it's getting students to recognize cues from the information that's presented and to be able to determine from that information what's pertinent in the setting or the clinical scenario. We can do these by using methods or activities of concept mapping. It can begin very basic in this process, involving only one concept. Students can take concepts or topics that are learned for that week and begin to apply them to a clinical situation or a clinical concept. For example, integrating safety or some of the cues and competencies, and having the students understand how that topic for that week that they're discussing and learning about relates to safety, and they can concept map this out. So drawing out what they're thinking, identifying what information is pertinent as it relates to safety and the presented topic for the week. The same can happen in a case study format. Students can be presented with patient information. They can take this information and identify cues and pull out relevant data from the case study. This is a great opportunity to engage students in pairs or in small groups, that they can work on various case studies throughout the classroom environment. And then when they're all done, they can come together as a big group and discuss what their findings are and compare and contrast why maybe some of them might be similar, some of them might be different. The faculty can also kind of mix up the case studies if they want to, and maybe different groups have slightly different case studies, maybe having similar patient diagnoses, but maybe some of the presenting information is slightly different. So the students then have to identify in each case what's pertinent. Using the nursing process is another great activity, allowing the student to walk through the process and taking the information that is shared and being able to pick out that important information in that hypothetical patient situation. Sorting through the information, recognizing those clues, and then developing a care plan or concept plan or map or a clinical plan of action. Open-ended questioning is a way to get students to think about what they're thinking about. They can begin to rationalize. They can think about their assessments, what their priority actions might be. An example of using open-ended questioning would maybe be looking at lab values, using this exercise in a patient scenario that identifies various lab values related to the patient. The students can identify trends, develop priority actions based on what they know, and they can explain why they chose those paths that they did. So they're verbalizing that process as you're asking questions. And in the beginning phases, you may have to prompt some of those questions, but then as the student begins to think out loud and begins to engage in that discussion, you'll see that process unfold. Faculty role modeling is another great way for students to learn. Being open and transparent with your students instills trust and development. When faculty role models active learning, the students are more apt to engage in this active learning as well. Students can ask questions and faculty can say something like, let's work on that together, or let's work together to come up with an answer. Demonstrate what's known, talk about what the expected or anticipated outcomes might be, what might be priority here in this particular situation, and consider those potential outcomes and reflect on the process. Again, the faculty can do this by thinking out loud, and it allows the students to see how that process unfolds, and then they can use that model in a clinical situation or encounter. Gaming is another way that leads to creative, fun ways to get students engaged in active learning. There's collaboration, there's discussions, questioning, reasoning, and reflection that occurs. There's a variety of different gaming options available, or faculty can create their own gaming if they would like. Students get excited about playing games. Often there's that component of friendly competition. They want to win, they want to do well, they want to impress their peers. All the while they're doing this, learning is occurring. Students describe this type of learning as fun. They often share that it didn't feel like learning at all. But when the larger group comes together at the end of the class period or after the activity has concluded, they do a debrief and they realize that learning really did indeed happen. As I mentioned, you can create your own games. Sometimes these can require a great deal of time and preparation, so be prepared, but they can also be used over and over again, class after class, and be modified and tweaked to relate to the particular concept or topic that's being presented. Communication is a lot like faculty modeling. I think when you're working with students, demonstrating proper communication, asking the appropriate questions, knowing how to interpret the information that's coming back through a communication experience, to be able to pull out those pertinent cues and recognize information that is relative to then developing a plan of action. Faculty can model this. Students can then engage in communication, data gathering, history taking activity with a peer, and then again, regrouping after the activity and reflecting on the learning opportunity with the larger group, discovering what was learned and its relevancy to that clinical situation. Guided journaling is another way. Again, in the earlier phases, guided journaling may require some prompting. Faculty can provide some of these key prompts related to the topics or concepts that are being discussed in class, and students can then have a opportunity to reflect on that learning and discover what they knew prior to coming into that class session and engaging in that activity or that guided journaling assignment, and then learning and reflecting on what they took from that class, that learning that happened in class. So some of the prompts with guided journaling could be, what did you notice about this particular clinical situation, or maybe this patient with this particular diagnosis? Or what did you see in relation to patient safety as you explored this patient scenario? And the students would then open up dialogue through writing and reflecting in that journaling fashion. Let's take a look at critical thinking in the lab or clinical setting. Now, some of these actions are going to be repeated actions, and it's really just taking it from a two-dimensional into a three-dimensional environment. So in a static environment, classroom, textbook facing, case scenarios where they're reviewing and processing to a live environment where the client interactions are real. Students might notice that client interactions or client presentations are not exactly like the textbooks. And so they may have to tweak their concept mapping or their application of nursing process or the ways that they communicate to adapt to those real clinical environments. Students also find out that they're not looking at one concept at a time when taking care of a client in a clinical environment, that there might be various concepts that they have to consider, various diagnoses that play into recognizing clues and determining what's pertinent information to be able to develop and prioritize their care and actions for the day. A couple other critical thinking exercises that can happen in clinical or lab involve the chart or the EHR scavenger hunt. This is great to do, especially if you're new to a clinical environment, giving the opportunity for students to explore that patient chart or that patient record to find out how much information is actually contained within that chart or that EHR. And then students can use this resource to leverage and enhance patient care delivery by being able to develop further processes of developing hypotheses and implementing and prioritizing care based on not only the information that they gathered from the patient encounter, but also pairing that with the information that they gathered from the chart. Another popular activity that students can engage in clinical is that 60-second assessment. A student has virtually a minute to go into a patient's room and determine what's important and what's not important, what information they can take with them to then begin to process, begin to develop those hypotheses, and begin to develop actions to implement to then play out patient care. So a 60-second assessment after a student goes in, gets their 60 seconds to gather clues and gather information. They come back out and they have a moment of debrief with their clinical instructor or with their nurse or a peer and talk about what they saw and report their findings or assessments to that instructor or their peers. And based on this assessment, they begin to develop a thought process that allows them to prioritize that care for the patient and identify other areas that might warrant further exploration. Also, I have in here open-ended questioning, as we talked about in the classroom environment. Again, getting the students to think out loud. This can be paired with that 60-second assessment. Anytime throughout the clinical day, it could be done one-on-one, or you can use open-ended questioning in a larger group environment, such as in a post-conference clinical meeting. Again, the faculty role modeling piece is there, as described earlier, only taking it to that clinical level, and actually students are able to see the faculty in action, engaged in a client encounter, engaged in an encounter with maybe a physician or a charge nurse or a pharmacist, and see how that plays out. And all the while they're learning how to engage in communication using that professional nursing language. And of course, with all activities, there's always an opportunity to do that debrief, whether that debrief happens right after the conclusion of that activity, or if it happens later at the end of the clinical day in that post-conference environment. It's important to have that debrief so that the students can process what happened, what they learned, how they prioritized, and how they can take that learning forward into their next clinical encounters or experiences. Let's go ahead and take a look at clinical reasoning in the classroom. So now we're jumping into clinical reasoning and what that looks like. So again, keep in mind, what is it that we're looking at when we're seeing if students are engaging in clinical reasoning? You'll find that many of those activities are similar to those that were discussed during critical thinking, but now we're just taking it a step further. Students still need to recognize clues and they need to gather pertinent information, but now we start to take that information and begin to process this information. We take this information and we apply it to what they already know or what they've learned or developed so that they can begin developing hypotheses and begin formulating plans of action to be carried out in the clinical setting. Teaching to peers, leading discussions, providing peer instruction and peer evaluation are all great methods that allow the student to take ownership of that instruction or by leading discussions. And in doing so, this can happen with any assignment or concept. The student truly must understand the concept. And when they truly understand that concept, they're able to turn around and teach it to others, explain it to others. And that's when they really can put those pieces of the puzzle together and interpret and redirect to a teaching environment. Opportunities to teach peers can happen in pairs or in small groups, or they can present to an entire classroom. This also allows their peers to ask questions, and those that are teaching or leading discussions can answer those questions, and they can also turn around and ask questions of the audience or those that they're teaching. When leading discussions, this can happen in a classroom environment, a face-to-face setting, or can also be done through virtual settings through an LMS, like in a discussion board format. And again, students can have topics assigned to them, allows them to take a deeper dive and to fully understand the topic or the concept, and then lead those discussions, come up with questions, and guide that discussion based on that particular clinical topic for the week or the day. Reflective writing is another way. It's like reflective journaling. The students have the opportunity to write out what they know, what they've learned from before, process this information down on paper. They can do this in a notebook. They can do it in a discussion board format. And again, if it's early on in the learning phase for the student, there may be prompts that the faculty can provide to kind of initiate that reflective writing piece. Debates are another great way for students to engage in clinical reasoning in the classroom. Often debates are best aligned with leadership courses or nursing ethics courses. Students have to pick a side of a particular topic, and they have to learn that side, whether they're pro or con, and they still are required to learn the opposite or the opposing side in order to develop questions, responses, rebuttals as they go through the debate. This works really well in a pediatric type environment or with pediatric situations, and particularly with various cultural and religious beliefs and practices that may bring up ethical concerns. This also helps students to develop clinically competent care or culturally competent care delivery when they're addressing ethical concerns that are brought forward. Case studies and problem solving, again, similar to what I've discussed earlier, but taking it to that next level. These case studies have that pertinent information that the students have to pull out, but now they have to take that step further in the process and anticipate what comes next. They have to start processing that information and developing interventions to be able to carry out and place them in prioritization order of importance. Post-activity, students can report out to the class and they can engage in larger group discussions and reflect on those outcomes that they came up with the case study or the problem-solving activity that they had. Talked about the peer instruction and adding that peer evaluation component to that, allowing the peers to provide an evaluation. Sometimes students respond well to this peer evaluation. They feel like the playing field is a little bit more level, and they're open to hearing what their peers have to say or feedback that they have to give on a particular situation or presentation or instruction that maybe a peer had led. Flipped classroom, we've talked about flipped classroom a lot in nursing education. Flipped classroom essentially boils down to taking some of these activities, taking assignments, quizzes, discussions, and moving them outside the classroom environment, allowing the students to engage in these kinds of activities or assignments, quizzes, or discussions prior to coming to class, helping them be more prepared for class so that indeed what can happen is when the students enter into that classroom automatically turns into an active learning environment. I like to think of that classroom being an actual clinical environment, bringing it into perspective with those particular topics or concepts that are going to be addressed that the students already prepared for in that flipped classroom format. Be prepared, though, if you haven't used this strategy before, that initially students do give some pushback. It's different, it feels different, and they just want to come to class and have the instructor feed information to them. Just tell me what I want to know or what I need to know to get to the next level. And we know that through research, this type of learning, which is also referred to as passive learning, is not effective. Think for a moment, if students are engaged in lab or clinical experiences, this is similar to that flipped classroom environment. They have to prepare information prior to entering that clinical encounter or that patient encounter by getting information from their nurse, from their chart, the patient's chart, to be able to then begin to develop how they're going to respond when they have that patient encounter. So this sort of thing can also happen in a classroom environment. It gets the students engaged in active learning. So go ahead and give it a try and turn your classroom into a clinical experience. Looking at clinical reasoning in a lab or clinical setting, Socrative clinical questioning comes into play here. Asking students questions using a Socrative method stimulates deeper thinking and processing. Instructors or faculty can introduce hypothetical situations or examples to allow students to think beyond that present moment, to explore complex ideas and to anticipate potential actions and outcomes as they relate to their patient or clinical situation. This can be done at various points throughout the clinical. It can be done one-on-one with students or at the end of the clinical experience in that group setting in a post-conference to engage students in that lively discussion and sharing what they've learned throughout the day. Again, reflective thinking is a lot like that reflective journaling or that guided journaling experience. Only reflective thinking can happen out loud. Thinking out loud, asking students questions, prompting them to go in different directions, allows them to focus on the process of making clinical judgments about what has happened in the clinical environment or what might be currently happening in that clinical situation. Reflective thinking can be the students verbalizing their thoughts in that moment. You can also move it to a written format if you desire, or if the student desires to do so. And again, this can be done through various stages throughout that clinical encounter or experience. Essentially, it's getting the students to deliberately pause and think about what's going on around them so that they can develop appropriate actions and evaluations to move forward. Again, faculty role modeling comes into play when we talk about clinical reasoning. Students learn from seeing their faculty engage in clinical encounters, hearing those questions that faculty ask, seeing those faculty and hearing those faculty think out loud or verbally process a clinical situation. EHR exercises and medical record or medication administration record exploration are also great exercises that get the students engaged in activities to allow them to take a deeper dive into the patient or client record. This is beyond learning where everything is housed within an EHR or a medical administration record. Students can be assigned to look up specific lab values, maybe on 10 patients. So they're going to go to 10 different EHRs, look at different lab values, and compare and contrast various treatment options as they relate to those lab values or particularly abnormal lab results. They can also identify trends and reflect on anticipated outcomes. Students can similarly look at specific medications prescribed to multiple patients and explore the reasons for this medication. Again, comparing and contrasting the indications for medications as they relate to patients' conditions and circumstances. And of course, clinical reasoning can happen in a simulation, a patient simulated scenario. It can be simple or complex. They can have brief encounters or they can be long unfolding cases where students have to think about various possibilities or anticipate expected or maybe unexpected outcomes and process and prioritize and act based on what they know and apply their knowledge to the simulated encounter. Simulations can be static, they can be low fidelity, or they can be high fidelity. They can be virtual or live. And I'll talk a little bit more about simulation as we move into the clinical judgment component. So now moving on to that clinical judgment in the classroom, what does it look like? Again, active learning strategies. I've shared with you here, think, pair, share. Having activities about clinical scenarios, patient scenarios related to certain topics. A student can take that information and independently think about it for a minute or two. Think about what is the information that's pertinent here? What information do I need to gather in order to develop a plan of care for my patient? And then they can start to process and develop hypotheses. They can take information that they've learned in previous classes or previous patient encounters and apply it to that particular concept or topic for the day. Then they can pair up with a peer and they can talk about what they came up with this client scenario or this case study. And they can share and compare what they've learned independently and talk about why one cue that they pulled out is more important or more pertinent than another, and that could guide their prioritization of care. I mentioned case studies. You can use case studies along with this think, pair, share strategy or problem solving using a think, pair, share approach to that. Again, flipped classroom is mentioned again here. Taking some of those activities and engaging students outside of the classroom in a learning management environment, or doing some quizzing, or maybe having some little recorded snippets of lecture, or going out and looking at YouTube videos or other resources to help them have an understanding of that particular concept or topic. And then bringing it back to that classroom and taking it a step further and seeing if the students can recognize those clues, pull on information that they already know, apply it to the current situation, and be able to prioritize care, develop those hypotheses, develop actions that are appropriate for the case study or the problem-solving activity that they're doing, and then be able to carry out those actions or those anticipated actions. And more importantly, in the clinical judgment phase, they're beginning to then evaluate those actions and reflect on how that process unfolded, reflect on the learning that they have obtained or the information that they've learned from that experience. So taking it again another step further, taking that critical thinking, taking that clinical reasoning, and beginning to put it all together in a clinical judgment fashion to be able to make clinical judgments that are appropriate to patient care. Asking questions, naming the top 3 priorities or actions that a student might take in a given client scenario or case study, and how that priority action relates to that scenario and providing rationale. Again, this can be done independently or can be done in pairs or small groups. You can present the students with data in graphs or tables. Students are then able to identify areas that maybe support clinical decisions or judgments. They take a look at that data that's been provided, and it allows them to identify trends, anticipate actions, prepare and prioritize care based on that information. Unfolding or progressive case studies can also be done similarly to what we talked about before in those other models in the classroom, only now they have the information in front of them, and the clinical faculty or the classroom faculty comes around, and while the students are engaging in that process, you hand them another cue, or you hand them another outcome, or maybe the vital signs have changed, or maybe the O2 stat has declined, and now they have to realign their thinking. They might have to go back and gather more information, or they might have to realign their hypotheses to be able to come up with more actions and, again, prioritize or align those actions to be able to derive at the clinical outcomes that they anticipate. So what does clinical judgment look like in a lab or clinical setting? Again, asking those questions. Um, they can, again, name those top 3 priorities for your patient. What are you going to do today for your patient? What are your top 3 priority actions that you're going to take with your patient today? Ask the student to provide that rationale for their answer. And depending on what the level of student is, perhaps they're going to be required to then prioritize that care for multiple patients. Maybe they're beyond taking care of one patient and now they have to identify which patient they need to see first based on the information that they've gathered from their report or their assessment in the chart. They can do a note card exercise. And in this note card exercise, they are to identify 3 things that they can delegate, or maybe 3 things that they are not allowed to delegate. This allows students to learn the roles of other healthcare professionals. It also is providing effective ways for them to manage their care and their time, and optimizing the resources and people that are available to them to be able to carry out the plan of care. It also helps students to further understand their scope of practice as a nurse, as well as the scope of practice for the other healthcare professionals. You can do a lab values exercise where the student has to determine lab values and whether or not, based on these lab values, is the patient's situation or status improving or is it declining? And explain why they think it's improving or why it's declining, and what clues or cues led them to believe, for them to drive at this conclusion, and what are they going to do about it? What are the anticipated actions? What are the anticipated pieces that they're going to implement so that they can get that patient back to improving their clinical situation or improving their status, or stopping them from further decline. As I mentioned, simulation. Again, simulation can be virtual or live simulations. In a virtual simulation like that of what Kaplan has, their iPatient virtual simulations, these allow for standardized clinical opportunities or encounters for students to demonstrate their abilities to make clinical judgments. As the students move through a virtual simulation, they're presented with expert feedback after each module. They can learn and they can carry this information forward into that next phase of that simulation. In live simulations, often the direction of the simulation is dependent on the responses of the student. While faculty can try to guide that simulation back using cues from the patient or maybe the family member that might be at the bedside, but if the student goes too far in a simulation and not making the right choices, there's not always an opportunity for that expert feedback to happen or to occur until the simulation has been completed. Therefore, they have to move into that debriefing mode before they can give those opportunities and share that feedback. In a standardized simulation patient encounter, such as a virtual simulation, that feedback is ongoing throughout the simulation, so the students can redirect before moving on to another phase. Another example is compare and share. Compare and share is an opportunity if your students are on a particular unit where there's multiple patients with similar diagnoses. Students can go and look at several patients that have been admitted with that same diagnosis or that may have similar underlying medical problems. And they can examine these charts, examine the treatment modalities that were prescribed based on the disease presentation and what the outcomes were on the different or for the different patients based on those treatments that were implemented. And they can compare and contrast why they were different for one patient versus another and reflect on that. They can do the same thing with medication, why this medication was prescribed for this patient with this respiratory illness versus another medication that was prescribed for another patient with the same disease process, but maybe it's a different medication that's been prescribed, and reflect on that process. So next I want to move into evaluating critical thinking, clinical reasoning, and clinical judgment. Again, I want to pause for a moment and share with you that regardless of what it is that activity that you're doing, you'll see some of these same activities populating on my slides here, but you have to think about what it is that you're evaluating with the student. So if you're evaluating the student's level of critical thinking, this can be done in a variety of ways depending on the activity or the work that the students are engaged in. And the evaluations can be done through direct observations. They can be objective or subjective, formative or summative. And they can use, faculty can use rubrics to provide concrete ways of evaluating students. So regardless of what it is, the activity that you're evaluating the students, think about whether or not the students were able to recognize cues, pull out pertinent information from these activities. Maybe it's worksheets, maybe it's a debriefing opportunity, maybe it's a role play or a debate, guided journaling, gaming opportunities. Maybe the student had an opportunity to write a 1-minute paper, and as you review that 1-minute paper, did the student pull out that important information to be able to carry that forward and begin the process of applying that information to information that they already know and develop those hypotheses and develop a plan of care. Quizzing is another way to do this. It's a little bit more concrete, but asking those questions in a quiz format, and did the student be able to recognize cues in that question or those answer choices to be able to determine what's pertinent information to carry forward. And then muddiest point note cards are often used in a reflective manner as to whether or not students are understanding concepts or topics. This opportunity can allow a reevaluation of areas that maybe students aren't fully comprehending. It gives the faculty an opportunity to revisit topics or concepts and use active learning strategies to, again, guide the students to be able to develop a more comprehensive understanding of those topics or concepts based on this information that students have provided. So it's kind of a reverse way of determining whether or not they were able to pull out and recognize cues from information that was provided in those various activities. Evaluating clinical reasoning, again, you're going to see some of those same words that are populate: questioning, quizzing, examinations, reflection. And again, thinking about what it is that you're evaluating the students on. So like with critical thinking, you looked at whether or not the student could pull out pertinent information, that they could recognize cues and begin to analyze those cues. Well, now we're taking that clinical reasoning to another level. We're integrating that critical thinking piece and adding that component of starting to analyze those cues, analyzing that information they've gathered, developing hypotheses, maybe going back to the drawing board, gathering more information to then refine their hypotheses, to then be able to prioritize care, develop actions, and implement those actions in the client setting to be able to deliver that safe, effective patient care. So again, looking at the types through questioning, can you take the students through that process to be able to get them to analyze those cues and that information to be able to then develop those hypotheses, develop prioritizing action, or be able to prioritize those actions to carry out in that clinical opportunity. Examinations can do this as well, taking out that pertinent information and being able to apply it to that clinical situation and deriving at priority actions that the nurse must take, and then selecting those actions that make the most sense. And then reflection, again, can be verbal or can be written, and the faculty will have an opportunity to evaluate that thinking process, whether it's out loud or on paper. Taking a look at evaluating clinical judgment, again, using rubrics. There are rubrics available to guide these evaluations. They are related to the student's ability to make those sound clinical judgments. These often include key checkpoints that the student must get to or identify within a patient encounter. These rubrics are an objective way to measure whether or not the student is making sound clinical judgments. Rubrics can be developed for various types of activities like we previously discussed. I can share with you that there is much literature out there on the Lassiter model or rubric to evaluate clinical judgment. It's a great rubric that can be used to do just that, is evaluate clinical judgment for a student in a clinical encounter or a classroom activity that they might be engaged in. These can be adapted to be used at a critical thinking level as well as a clinical reasoning level. Again, concept mapping, taking it to that next level. Maybe you're introducing multiple patients, so the students have to then gather all of the information on multiple patients and start prioritizing care. Which patient do they have to see first based on the information that they've gathered? And can they tie all of these patient encounters to common concepts such as safety or evidence-based practice outcomes? Essays is another way to get students to reflect on their learning. Can they demonstrate their ability to identify or recognize pertinent information? Can they demonstrate their ability to process and develop a plan of action and anticipate potential outcomes and reflect on those experiences or those scenarios as they replay this experience in a writing format? Examinations we talked about. Again, this is another objective way to evaluate students' abilities to make those clinical judgments. They can be given in exams that contain questions that are related to scenarios. Students are required to use layered thinking, processing, hypothesizing, and prioritizing to be able to derive at the appropriate answers, which are often an action component. Question types that stimulate clinical judgment might include enhanced hotspots. It could be extended multiple response questions, above and beyond what we know as those select all that apply questions. Extended drag and drop, again, prioritizing care based on the client information, based on the presenting information in the clinical situation or in the clinical excerpt that might be added to that particular question. So they might have a little bit of a clinical situation that they have to read. They might have data from a chart exhibit or a medication administration record that they have to look at to be able to take that information, process it, and analyze that information, and then be able to develop those hypotheses and evaluate and prioritize actions and carry out those actions through this type of examination and coming up with those appropriate question or answer choices. Close or fill in the blank. Again, there's a patient scenario. There's an exhibit that the students have to look at. Maybe it's trending vital signs, or maybe it's trending lab values, or maybe it's all-encompassing of multiple data points that the student has to determine whether or not the patient's status is improving or declining. And they have to be able to fill in the missing blanks, fill in those opportunities that maybe aren't present, that they have to determine what is the best action to take. Again, simulations, as we talked about, the benefit of both live simulations as well as virtual simulations. And when they use virtual simulations, they can take those recordings and they can be scored. This takes that evaluation or that work off the faculty in a virtual simulation, and it creates reporting that the faculty can review and determine whether or not the student made the right choices throughout the virtual simulation. And did the student click the right responses in that virtual simulation? Did they take the right actions? Did they prioritize their actions in the right order before implementing care? Another exercise is EHR documentation, reviewing with the student right by their side when they go to document in the EHR that clinical encounter. Did they draw appropriate conclusions based on the information that they gathered and analyzed? Did they carry out priority actions for the patients? Did they properly evaluate the outcomes? And as the faculty is right there reviewing this with the student, it opens up opportunities to provide additional teaching and reflecting moments as needed. So I know I've covered a lot of information throughout this presentation, but I wanted to share with you briefly, you see up on the screen now are my references that I used to pull together this presentation today. And I also want to share with the audience an opportunity to provide questions that you might have based on the information that's presented, or perhaps comments that maybe you want to share that we can have that discussion. So let's go ahead and move into the question and answer phase of this presentation. And I'd like for you to go ahead and put your questions in the chat feature, and we'll go ahead and answer those. So I see that there's some questions that are coming in. One question that's been posed is, are there any specific activities that work better than others to help develop students' abilities to critically think, reason, or make clinical judgments? I have discussed a variety of activities to provide many different opportunities to engage students in critical thinking, clinical reasoning, and clinical judgment making. My recommendations would be to try one or two activities and see how that goes. Just as people have different learning styles, there will be activities that will work well with some students more than others, and that's okay. Also, the faculty may feel more comfortable using one type of activity over another. And the key really here is to engage the students in learning, engage the students in that active learning. And we know that from our literature that that's where learning happens. What types of, another question that's coming in, what types of changes to the NCLEX question format do you anticipate? These are great questions that are coming in. And as I mentioned in previous slides, there are a variety of different kinds of questions that are involving multi-layers. So not only is it just a question that the student has to read and then go right to selecting an answer choice or the best answer choice, they might have a case scenario. They might have to read a client encounter or a client situation, take the pertinent information or the cues that they can recognize from that client scenario, and then maybe apply it to data or graphs or labs or medications, and then start to analyze those cues and that current information that they've pulled from the chart and develop priority actions, start to develop hypotheses to then move into the development of priority actions to take. So it's multi-layer questions. We will have some further webinars that will go over some examples of this type of questioning. So more to come on that, but definitely taking that question level to a higher level of thinking, and students have to take multiple pieces of information and pull it together to then come up with that answer choice that's appropriate. The question is, are the slides going to be available for future reference? This presentation is being recorded, so that slide presentation will be available. And when that's ready, that will be pushed out via email to all the attendees that are here today. Suggestions for getting students to engage more readily. The question came up that it's very difficult to get them talking, particularly in a classroom setting. Sometimes what helps with this is using that flipped classroom approach, getting them to do some of the work prior to coming to class, engaging in an activity. Students do like videos. There are resources out there that they can go to, videos. Kaplan has an NCLEX channel where they can go out and watch recorded sessions or live sessions about particular topics to help them kind of think about what the topic is boiling down to. Sometimes students are a little reluctant because maybe there's that component of they're not sure if they know or they're going to head down that right path or not. So allowing them to engage or dabble in some of that information prior to coming to class will then allow you to engage that student. Hopefully they'll start to talk and engage in those activities, and you can see that learning happening. Another question's coming in. Do you suggest case study type questions with multiple answers for fundamental students? Probably starting out with simple topics and advancing to more complex. Absolutely. Getting the students to take a case study and identifying cues in that case study type question, being able to pull out pertinent information and applying it to what they already know, and then being able to formulate an answer or a best action to then choose to be able to answer that particular question. You might see some of these kinds of case study approaches with the next gen NCLEX type questions. We'll go ahead and pause to see if there's any other questions before we close. I know we did go over our time limit a little bit, but I do feel it was important to bring forward any questions. One question that I know is on everybody's mind, and that is that when can we expect to begin seeing next gen questions appearing on the NCLEX examination? The NCSBN has indicated that changes to the NCLEX RN as it relates to the Next Gen NCLEX project is not going to occur until the very earliest 2023. Now, I know that that seems like it's a long ways off, but really and truly, it's not. If we think about the students that are entering into programs, particularly bachelor's programs, and especially if some of those nursing courses start right out at that freshman level, they're going to start seeing or needing to be preparing for these types of questions that we're going to be seeing on the next gen NCLEX. And so I can assure you that Kaplan has been working behind the scenes. There's many individuals and experts that are engaging in work behind these scenes, preparing resources to be able to implement and assist our school partners when it comes to preparing students for that next gen NCLEX. Great questions. Any others that are out there that we'd like to address? Okay, it looks like there's no further questions coming. I want to take this opportunity to thank each and every one of you for joining me today during this webinar, and I wish that you have a very pleasant afternoon. Thanks again.